So, Bruce, thank you for accepting our invitation to talk about your workshop at the Academy of Psychotherapists. It's going to be a great pleasure to have you in Lisbon. So the title of the workshop is What Makes Psychotherapy Work and How to Be a Better Therapist. It's a great title. It opens our curiosity. Can you tell us more about the workshop, please?
Well, first, thank you so much for the invitation. It's will be a great experience to work with a therapist in Portugal. So, of course, we all got into doing psychotherapy because we want to help people and we want to do the best job we can. It is a bit frustrating because as we study therapists, we're learning that it's really difficult to improve as a therapist. A lot of considerations, but we do this work in private. We don't get much feedback. It's really difficult to improve our skills. So I'm really dedicated in the last part of my career here to helping therapists improve.
Okay, okay. So, Bruce, tell us something. You know, it seems that research is suggesting or confirming that all therapies works equally well. So do you think the field is now in the moment to be more focused on the therapists rather than on theoretical models?
Well, I would like to be optimistic. There's still too much focus and too much argument about which treatment works better. And as you say, most treatments, if they're intended to be therapeutic, they're given by therapists who believe in them, are about equally effective. But what we know, Daniel, is that some therapists of each type of therapy get better than other therapists. So what's really important is the therapist giving the treatment. So there's really effective CBT therapists, and then there's less effective CBT therapists. Same for dynamic therapy or emotion-focused therapy. So what we have to figure out is how we can help all therapists get better at giving the treatment that they think is best for them. So I don't have any issue with therapists saying, well, I like to do CBT or I'm a psychodynamic therapist. I'm supportive of that. But let's give it in the most effective way possible.
Okay, okay. So we know there are a lot of questions to be answered about psychotherapy, but do you think we already know what are the dimensions that helps more therapies to be more effective?
Yeah, that's a great question. I mean, that's the critical question is what is it that the most effective therapists are doing? And those are the skills the rest of us should be practicing if we want to get better. So the research in the last 10 years has started to identify what those skills are that make effective therapists. I don't want to say too much because I want people to come to the workshop and learn what they are. But they really are skills in the area of interpersonal skills in challenging interpersonal environments. So these are not skills like I can go to a party and I'm very popular and people talk to me a lot, but these are in when emotions are very strong and difficult, then you can see the skills that are displayed by the more effective therapist. And then also the more effective therapists are good at structuring treatment in a way that makes sense to the patient. I understand why I'm working in this way. I know what to expect. So it turns out that there's really two domains, the interpersonal domain and the structuring domain.
Okay. One more thing, Bruce. You know, we often listen from colleagues things like this. I do my clinical work, I did my training, I do my supervision, but after some years, I don't know exactly how to develop my clinical skills.
Mm-hmm.
what do you think about this? What can we say to our, to our colleagues and clinicians about their development?
Yeah, well, it's interesting because we should look at the area of expertise in other areas. So musicians practice a lot outside of actual performance. Same with sports people, chess players. We know from the area of expertise that what characterizes experts is that they spend a lot of time outside of practice on particular skills with a coach. It's very difficult to do that in the psychotherapy world, but we have to learn from these experts and start to develop ways to practice these particular skills. So much of the workshop is going to be devoted to this idea of deliberate practice and how does it work in psychotherapy, because psychotherapy it's a tough job. I think much more difficult than playing chess or music performance, because you kind of know what to expect there. Patients always come with something different. It's difficult. We do the work, as I said before, kind of in private. So there are ways we can get better.
Okay, and deliberate practice is different from supervision?
It is. Supervision, we can integrate deliberate practice and supervision, but I think it's going to take some change in the way we do supervision.
Okay, one last question. What is your main research interest for you now and for the next years?
Well, thank you for thinking that there's going to be many next years. I appreciate that. Uh, I really am dedicated to this notion of how do we help therapists improve. So I want to research about the aspects of deliberate practice that actually result in improved outcomes for patients. You know, we do a lot of interesting psychotherapy research, but I think we need to be most focused on what are the ways that it's actually going to improve the quality of the services. We owe that to the patients we see, that the research should be aimed at improvement. So I want to study whether teaching deliberate practice and having therapists spend some time outside of their time seeing patients will actually improve outcomes.
Okay. Bruce, thank you so much. We really look forward for your workshop here in Lisbon. So we hope to see you soon.
Well, Daniel, I'm looking forward to it, and I'll see you very soon. Thank you.